Hi, this is Marjorie Wallen. Today I will be going over the axial skeleton for my anatomy class. So first we're going to start with the skull, which is actually several bones that are fused together. All right, this is the skull. We're going to start with looking at the skull's kind of interesting. This part of it is made primarily to protect the brain, whereas the front part is made mostly for muscles getting stuck to the bone in appropriate places. It's also made for holding things like the eyes and the eye socket. So two very different purposes for the facial bones versus the skull bones. So when we're looking at the skull, in the front we have a frontal. The sphenoid is this very small joint that is actually right here behind the eyes. The ethmoid is in the eye socket. It's very small. The temporal is where you would think of your temporal lobe, right here. The occipital is in the back. And the parietal is this large part in this area. All right, the temporal bone, this is going to be a little harder to see on the skeleton, on my skeleton. It's actually several smaller bones that are made up in it. We've got the squamous process, which again it's very hard to see. The mastoid process, the external auditory meatus. The mandibular fossa, which is down here where it's connecting there. The zygomatic process. There's also the sphenoid bone. That one, I don't think we can see it from this angle. Maybe we can. Yeah, it looks like we can see it. So that's this butterfly looking bone right here. So there's the greater wing, the lesser wing, which is the smaller one right here, superior orbital fissure right there, and the optic canal, which are right there. Next we're going to look at the cranial sutures, which ironically my skeleton, it keeps falling off, which might make this just a little bit easier. There's a metophyk, which is right here. I think that one's one of the ones that actually seals up. The anterior fontanelle is right here. Again, that one seals up as you get older. The coronal is right there. The sagittal right here. The lambdoid is usually here. Again, that one seals up as you. Alright, so we're going to do the facial muscles again. Again, these are primary flat bones that are made for holding tissues and protecting organs like the eyes. So when we look at it, we've got the frontal bone, which is here, the parietal nail, which is here, the sphenoid bone, which is the small one right here, the temporal bone, which is the larger one on the side, you know where your temporal lobe is in that space. Your nasal bone is here, right above where the cartilage would be for the nose. The zygomatic bone is right here. It's kind of what we think of as the cheekbone. The Voiner bone is right here. That's the piece of bone that's supporting the cartilage of the nose. The maxilla is here, and the mandible is the jaw. All right, I've kind of broken my model's jaw so I can show you some of the bones here. We've got the mandibular condyles here, the ramus down here, the angle, and then the body of the jaw. The mental protuberance here, mental foramen. The alveolar process, mandibular foramen, corona. Okay, now we're going to look at the spine. We're going to start down here at the tailbone where there's the coccyx right here. The sacrum is this part. We have the lumbar curvature right here. The bottom bit of lumbar is the lumbar vertebrae, and that's L1 through L5. Next is the thoracic vertebrae, which is T1 through T12. The cervical vertebrae, which are C1 through C7. There's 7 of those. We also have the cervical curvature right here at the top of the spine. All right, now we're going to look at the sternum of my skeleton. The sternal notch is here. The clavicle, which we've already looked at, is right here. The mandrubium is this section right here. The second costal cartilage is right here. The sternum right here. And the xiphoid is right here. This little bit. The costal margin right here, and the costal angle is the difference between these two pieces. Next, we're going to look at the ribs. The true ribs are actually the top 7 because they are connected to the sternum. The false ribs are these bottom ones that are connected to the 7th rib right here. They're still bone, but they're connected, so that's why we call those false ribs. And then we have the floating ribs here at the bottom, these two.